All right, welcome back everyone to our final session. Give a minute or so until, as I set my timer. Well, welcome to the final segment of Hot Issues in Health 2023, our legislative preview. And immediately after this, we'll have a legislative panel. I'm Joe Hanel, I'm the communications director at CHI, and this is actually my 10th legislative preview at CHI. Thank you. It's my first time, though, with my new presentation partner, Kendra Newman, who is provided almost all the research and deep thinking behind this presentation. So if you like it, thank Kendra.
Well, thank you for that kind intro, Joe. Hi, all. I'm Kendra Newman, a research analyst at CHI, and I've been on our legislative services team with Joe about a year now, but have been following Colorado politics for many years, so I'm really excited to get to speak with you all this afternoon. And I'm going to pass it back to Joe to begin.
All right. Well, since we've had such success with technology today, and in keeping with the theme of the day, we decided to give Brian Clark, the hardest working creative director in Denver, the day off, and we asked AI to design our presentation. So hope you're really going to like the results. Let's see what it does. All right, computer, show us a picture of the Colorado State Capitol. Ooh. It really caught the reflecting pool so nicely, didn't it? If you've never walked around the Capitol, there is no reflecting pool. There's a golden dome, but the whole top of the thing is not gold. AI will try again next time. There'll be a few other opportunities here. Our takeaways for today, to shift to something a little less frivolous. The billions of dollars extra money from the federal government during the pandemic years, that's gone now, all but done. We are back to normal years with normal budgets, which means not a whole lot of money for legislators to play with. Second, we think it's going to be a very active year for policy in the legislature and for what we're all interested in here. We think mental health and housing are going to be two really important and hotly debated issues. And lastly, 2024 is an election year, if you might have heard, and to use a technical political science term, it's going to be bananas. So we'll go through each of these sections in turn, but first let's look back at our most recent election and some more AI art. If anybody wants a raffle ticket, can you tell me anything that might look amiss about this picture? The flags. Yeah, I thought most American flags I know have the blue field on the left, and just one blue field, not two of them, and not just 13 stripes. So raffle ticket back here, whoever said that, thank you. And if you wanted to look at this longer, you could probably find just about everything else with it is off. Let's look back at the most recent election, though, the Colorado state election just last month. The big story, of course, was Proposition HH, which was about property taxes and TABOR refunds and school funding. Colorado voters rejected it by more than 18 points. And there were a lot of reasons that they might have, and there are a lot of competing reasons. If you are a mainstream Democrat, you might, some of them blamed right-wing information during the campaign for it failing. If you're more on the left side of the Democratic spectrum, you could say that it was inequitable because it gave so much relief to homeowners rather than renters. If you're a conservative or Republican, you could say voters wanted to protect their TABOR refunds. Or if you're somebody who's just been watching Colorado politics for a while like me, you could just say that when Colorado voters see something that they don't understand, their default is to vote no. You could say any of those, and you'd be right. That's beauty of political analysis, right? But it's important because this contest to define the narrative of Proposition HH is really about a contest to render judgment on the state's Democratic leadership. HH broke a long winning streak for Democrats in Colorado, and the lessons that people draw from it are going to really affect how they execute the next year and how everybody interprets it as well. So, of course, it was only a few weeks after the HH election that there was a special session to address property taxes and everything else associated with HH. This is not an AI picture. This is Governor Polis breaking glass with hitting the emergency break glass for special session. I kind of wish it was an AI picture, though, but this is reality. The lessons that Democrats drew from HH, at least from our point of view here, just still in the aftermath of the election, is that they seem to settle on the inequity argument with what happened in the special session. They passed several bills that did a lot of what HH did, but with more emphasis on helping out people with lower incomes. So there was temporary property tax cut, but there's also earned income tax credit, which is a proven bipartisan anti-poverty policy. There was aid for renters, and it focused on people who are in danger of being evicted. And flatter TABOR refunds, or flat TABOR refunds, I should say. So less money for the high earners and more for middle income and lower income earners. But again, all of this is temporary. The special session in no way solved the property tax and housing price crisis here. It's not a long-term solution to housing costs. So that sets the stage for the 2024 session. Kendra is going to talk about some of the old and new faces in the legislature. I want to share with you my favorite face, that the chair recognizes Representative Bigfoot.
Great. Thank you so much, Joe. And unfortunately, we don't actually have Bigfoot in our House of Representatives, though I think it would make our news headlines a lot more interesting. Hands up if you agree with me. So who does sit in the legislature? Well, as you can see, there are 100 legislators across both chambers, and 69 of them are Democrats. Democrats actually hold really strong majorities in both the House and the Senate right now. They have a supermajority in the House and are only one seat away from a supermajority in the Senate, which I'm sure would be an aim of 2024. You could ask our Democratic legislators who will be up on the panel in a second. But the reason that these majorities are so important is because it means that, although there are a lot of disagreements between Democrats and Republicans, of course, many of the most important disagreements that really impact the policies that pass happen among the Democratic caucus. And you'll hear me say that a couple times today, just because it's a really important dynamic in a lot of the topics I'm going to cover later today. And although there wasn't any election of legislators, we did see a couple new faces in the legislature since last session. There were 3 Democratic legislators who were appointed to fill Democratic seats, 2 in the House and 1 in the Senate, although this doesn't impact the overall balance of power. In the House, Representative Tim Hernandez took his seat for the first time in last month's special session, as did Representative Manny Rutinel. And I'll pause and say, some of you may have heard that another representative actually announced their intent to resign this morning, which means there will be another new face coming next session as well. And then in the Senate, former Representative Daphne Michelson-Janae was actually appointed to fill former Majority Leader Dominic Moreno's seat, which means that she moved from one caucus or one chamber to the other for last month's special session. And because Dominic Moreno left to go work for Mayor Mike Johnston, we also saw that Senate Democrats had to elect a new Majority Leader this summer. The man they chose was Senator Robert Rodriguez, who, if you all don't know him, represents a large swath of southern Denver. As Majority Leader, Senator Rodriguez actually has a lot of power in deciding which health policies are prioritized and deprioritized. And that's because he gets to set the calendar. And that means that at the end of session, when there's limited time, some policies end up dying on the calendar, and he has a lot of say there. And then the majority leader, of course, also has a lot of say in Democratic committee assignments in the Senate. And we knew changes were coming as soon as Dominic Moreno left his seat. But the two committees that we really watched closely that ended up changing are the local government and housing and appropriations committees. And the reason I'm calling out these two Senate committees is because housing has been a really big priority in Colorado for a while. And these were two big committees where really progressive Democratic-led bills actually got caught or had pretty big changes happen. Specifically, I'll call out a rent control bill that ended up dying in local government and housing, as well as the governor's highly publicized land use bill that I'm sure most of you have heard a lot about, that faced pretty significant amendments from Democrats in both of these committees. So we at CHI, and I'm sure many others in the crowd, will be watching to see how housing legislation does, especially in the Senate next session, because of these changes. And then to move away from individual faces, we did think it was really important to just name the rise in heated debates that we have seen this past year or so, and the rise in really, really long sessions, especially in the House of Representatives. Last session, we actually saw that the House of Representatives worked 8 weekend days, which might not sound like a lot to some of you, but really was, and kudos to all of the legislators who worked those weekend days. And then they also worked a couple of overnight sessions. And for a raffle ticket, did anyone here actually stay up and listen to an overnight session where the House of Representatives was debating? No. I see a representative who worked that session. Kudos to you for staying up for your job. But yes, when you combine those long hours, which kudos to all of the representatives in the crowd for working those hours, with the fact that a lot of really significant legislation tends to be introduced as late bills, that means that legislators have a lot of work the last 3 or so weeks of session. And last year, they actually had over a quarter of their bills undecided with 5 days left in the session, which means that during crunch time, when there's long hours of debating and high emotions, they have to make some important decisions about which bills they're going to let die on the calendar and which bills they will significantly amend. And I know a lot of folks who worked those last weeks probably don't want this reminder right now, especially as we're gearing up for next session. But with that, I'm actually going to turn it back to Joe, who's going to talk about the budget a little bit.
Thank you. All right, how are we doing? Well, that's exactly like the Colorado Capitol Dome, right? It tilts to the side like that, like it's about to collapse. All right, I'm going to go through the governor's proposed budget, which he sent to the legislature on November 1st. The legislature over the next 4 months or so will tinker with it, but the broad outlines usually don't change all that much. So let's take a look at some kind of takeaways from the budget. First, it's a back to normal year. That means there's not a few $1 billion extra in federal funds to create big new programs. We are seeing in Colorado some really strong economic growth. Wages are up, and that helps, and unemployment is down. That brings tax revenue into the state. It leads to a respectable 5.5% or so growth in the general fund. However, most of that money, 2/3 of it, is spoken for already by increasing demand for existing government programs. The budget economists call it caseload growth, and it could be more students, higher medical costs. Those are two big ones. So let's look at the broad outlines here. The total budget is about $46 billion, which sounds incomprehensible, but legislators deal with the general fund for the most part, and that is just shy of $18.5 billion. Of that, in this graph we're going to draw here, on the left side we'll show basically education, and on the right side education, and the left health and human services. Those are the two big things that take up the state budget. So K-12 education is about a quarter of the general fund. Higher education is quite a bit less than that. This little slice is the new Department of Early Childhood and the Universal Preschool Program. Then we have healthcare policy and financing, which by dollar in the general fund is the state's biggest department. This is Medicaid. Human Services is next. This includes the new Behavioral Health Administration. And this little red slice there is Public Health and Environment, which historically has not had a lot of general funding, although that has changed in the last couple of years as the legislature has made some investments in public health. And the rest, the last quarter, is everything else. So, public safety, agriculture, the governor's office, everything, all the other things the government does through the general fund is that one quarter. Diving into the governor's budget request, we picked out some highlights that we think are of interest to this crowd. First, an extra $560 million for schools to end the so-called budget stabilization factor, or the BS factor, which is definitely a Hall of Fame government acronym. This used to be called the negative factor, which was a little bit more descriptive but less colorful, because it was it figured the amount of cut that schools took each year versus the target that voters had said they wanted schools to be funded at. So that is finally ending this year, and we're back to what a lot of people would consider full funding for schools under existing law. Next, pay raises for healthcare. Woohoo! Especially, I'd like to call out direct healthcare workers. There's more than $50 million in this budget for people with really hard jobs and low pay. It's like home health aides. And it's hard to keep people in these jobs, so the thinking is they could use a raise to help stabilize that workforce. As I'd said, we've had continued public health investment. One of these items is $11 million for Social Health Information Exchange, or SHIE. And we at CHI are really gratified to see this because we've been working on SHIE when it was just a funny acronym. So it's great to see such a vote of confidence from the governor's office in funding it to this level. And if you're interested in learning more about it, just about anybody at CHI could tell you about it. I want to call out especially Ashley Brown, who's really spearheaded efforts for CHI and for Colorado in a lot of ways in this. And then finally, youth mental health funding. There are, again, a lot of different line items for this, but one to call out is $6 million more for the I Matter program, which gives any Colorado child the opportunity to have free behavioral health visits, mostly through telehealth. So the budget isn't the only policy, though. There's a lot that's not in the budget. Kendra is going to talk about that. I think AI really nailed the Colorado flag there, right? Yeah.
So unfortunately, we don't have much time to talk about the flag, but because there's so much that we have to talk about this session. We know that every session, the legislature takes on a ton of bills. Again, sorry for those of you who are already gearing up for session. I'm sure this is not a welcome reminder. But really the big topics that we're watching in the health space, which are a lot of really life or death important topics, can be characterized in one of two buckets: the unfinished business and the never finished business. And when I say unfinished business, I'm really referring to those bills that were sponsored by Democrats but didn't pass last session because of things like disagreements within the Democratic Party, funding constraints, or just lack of time at the end of session. And so I'm not going to go through all of those bills and topics, but there are two that I want to call out that I know are really serious, really life or death topics, where the Democratic Party hasn't really coalesced around a single solution or viewpoint. And the first is substance use. Overdose deaths are, of course, extremely high in this state. It is just a tragedy how high they are. And some of you may have heard of a string of overdose deaths among unhoused people last weekend, which is making me a little bit emotional, I'm sorry. But so there's a lot to be done to really try and lower the rates of overdose deaths. And there's been a lot of discussion about the best way to do that. And one proposal that's really gotten a lot of both criticism and support in the past year is overdose prevention centers. I know that some Democrats really like it. Others, including Governor Polis, remain pretty skeptical about the idea. And I don't know if that specific proposal will be coming back, but substance use certainly will be next session. There was an interim committee headed actually by Representative Degree Kennedy, who will be up here soon, that moved forward bills around treatment, recovery, harm reduction, and prevention. And then there was also a lot of discussion around the relationship between substance use and what the role of the criminal justice system should really play there. And Representative Amable has actually also done a lot of thinking about that, spearheaded a separate interim committee this summer. And then another topic that we are really tracking on is assault weapons. An assault weapons ban came up last year in the Colorado House of Representatives and ended up dying in committee. But because of the really high rates of firearm violence, we know that firearm violence prevention and assault weapons more specifically are likely to be a topic of conversation in the upcoming session, both among legislators and advocates. And then to move to a slightly less contentious topic, we also know that the newest state agencies are likely to be a topic of conversation. The Department of Early Childhood and the Behavioral Health Administration have both been around for about 1.5 years at this point, but they've taken a long time just to stand up because there are really major changes in Colorado government. And that means that fine-tuning takes a while, and legislative oversight is likely to be around for a while because of these major changes. Finally, in that unfinished business category, I wanted to call out affordable housing and housing stability. And this could be categorized as never finished business as well, I realize. But we really put it in this category because there were a lot of high-profile affordable housing bills that didn't get a lot of agreement last session that are probably likely to come back in some form or another this year. I will call out, in particular, land use and zoning is a really big priority for certain Democrats, and that's going probably to take up a lot of media attention and legislative time. But some other topics may include things like rent control and protections for renters. And then we're also likely to see some new conversations that we didn't actually see last year. And one that some of you may have read about in the news really focuses on construction defects and whether limiting liability for developers is a good way to incentivize developers to build more affordable housing. Now I'll switch back to that never finished business, which I mentioned early on. And I know there's a fine line between these two topics, but we're really categorizing in this area the topics that we're tracking on that end up being discussed every single session and often gain broad support that are really meant at chipping away at the issue without solving it. And as Joe actually already alluded to, healthcare workforce is always a top of mind concern and has been particularly top of mind since the COVID-19 pandemic. And so we know that more topics on healthcare workforce will be coming up and new bills will be emerging, including reimbursement rates for Medicaid providers and other healthcare professionals, as well as some other topics like licensing for healthcare professionals, loan repayment assistance, particularly for those in the behavioral health space, and then some conversation around healthcare worker safety. Healthcare costs are also a big priority. They have been a priority for as long as I've been following the legislature. And as I'm one of the younger people in the room, probably for a lot longer than that if you ask some other folks here. I know Joe, who has been following the legislature for a while, could talk about healthcare costs for days. But in recent years, we've really seen bills that focus on a wide range of topics, including alternative payment models and prescription drug affordability. I know many in the room are actually working on implementation of some of those proposals currently. But we expect to see other topics come up as well, including things like single-payer healthcare and studying how that could be implemented in Colorado, as well as discounted care programs in hospital settings. And then finally, in this never-finished business, climate, of course, remains a very prevalent concern for all of us. I know some folks just had a conversation about that in their last session. And so we saw interim committees this summer really talk about things like wildfire preparedness, water shortages and droughts, and air quality. And we know that those topics are likely to be topics of discussion this session as legislators really wrestle with the best ways both to mitigate the impacts of climate change and respond when there are acute climate disasters. And then finally, I did want to just give youth behavioral health its own call out. This is a perennial concern. This is a crisis, I think I could say at this point. For those of you in the last session, I know you've already heard this data, but 1 in 5 teenagers in Colorado actually struggles with their mental health in this state. And that's a number that's been rising for years instead of decreasing. And then many young people also report that they can't access behavioral health treatment when they need it, and that's particularly true when they're in crisis situations. And so given that, a lot of legislators have had a lot of conversations about what they should be doing. And this summer, we actually saw a pretty major proposal that was referred out of a committee vice-chaired by Senator Fields, talking about overhauling the behavioral health system of care for children and youth. That proposal could cost over $1 billion in future years. So this is pretty broad. On top of that, there were some smaller discussions about how to improve access to crisis services for children and youth. And then we also expect legislators to talk about suicide prevention this session, as well as social media and its impact on youth mental health. And again, some of you just talked about this, so you probably have a better idea of what that could look like than I do. But with that, I'm going to turn it over to Joe to close us out.
Thank you again, Kendra. All right, the 2024 election. You laugh, but can you bend your fingers like that? All right. We're calling the 2024 election unprecedented. The primaries haven't even started yet, but with the polling numbers looking like they are right now, it sure looks like we're headed for a rematch. And rematches are really uncommon at the presidential level in the US. You have to go back to 1956 to find the last one. This is the electoral map that put Joe Biden in the White House. And as he sits today, he is the oldest president ever to serve. And if Trump wins, he would be the second oldest to ever be president. So there's a lot of talk about how the age of the two major candidates is weighing on voters. I guess we'll see next year when it really comes time to vote whether this is a big deal or if it's just something to kind of occupy us and chat about while we wait for election year to roll around. A lot more important, though, is we have a major candidate who is under multiple state and federal indictments. We've never had that at the presidential level in the United States. He might even be on trial during the campaign. This is unprecedented. It's unpredictable. Nobody can say what kind of effect it's going to have other than it's putting tremendous stress on our institutions in our democracy. That includes the state legislature as one of our institutions. We can just expect this to be part of the background for the next year. Closer to home, we might have a very different House delegation by this time next year. First of all, 3 races to watch. Lauren Boebert on the Western Slope barely won in 2022. She will have another close race again this year. In fact, President Biden was just in her district a couple of days ago calling her out by name. Second, Ken Buck is stepping down from his seat on the Eastern Plains. The race to watch here is probably the Republican primary. This is a conservative district, and we're already seeing some state legislators start to express interest in this seat. And finally, in the state's newest district, Yadira Caraveo also had a very close race in 2022, and I would expect Republicans to heavily target that seat in 2024. Last thing on the ballot to preview here is ballot initiatives. Again, it's still early, but we have some early hints of what might be on there, starting with abortion access. There will probably be a campaign to protect the right to abortion in the state constitution. Legislators put it into statute a couple of years ago, but it is the Constitution offers a much more guaranteed, a much stronger guarantee of that right. Second, even though we just had a special session and another election about property taxes, you can expect that to be coming back. There are several initiatives in the works. And then finally, there was news last month about an election reform initiative that would do away with partisan primaries and set up ranked choice voting where you can vote for several candidates in the order that you prefer. The idea is to arrive at a winner who more voters could at least live with. So that's no shade on the elected officials in the room here, by the way. That's our presentation. Our takeaways, again, are it's a back to normal budget year. The years of easy money are done. Mental health and housing are going to be two big issues, especially youth mental health. And finally, bananas. So with that, Kendra and I thank you very much for your kind attention. We'll leave you with this picture of Coloradans walking on water, as we do. And then I'd like to invite up Sarah Schmidt to introduce our legislative panel. Thank you so much.
Nice job, Joe. Great. Good job, Joe. Thanks.
Thank you.
Okay. Thanks, everybody. Thanks, Joe and Kendra, for an excellent presentation. Please help me welcome up some legislators to the stage. Senator Rhonda Fields. Representative Krista Greig-Kennedy. And we are so fortunate that Representative Kyle Brown is willing to step in at the last minute. Senator Smallwood was not able to join today, but fortunately, and you are in the hot seat right here. Thank you. Representative Judy Amabile is going to be joining us virtually in just a couple of minutes. We need to do a little bit of a technology changeover, but have a seat, everybody, and thank you. So just want to give everybody a little run of show for the next 40 minutes or so. We will start with a couple of little we like to call them lightning round questions at CHI, just some quick things. Then we have a few questions that we'll all kind of talk through together, get some reactions from you. We want to leave lots of time, though, for audience questions. So writing them down, get them going, and we'll pivot over to all of you, both our virtual audience and those who are in the room, to have some questions. Sound good? Okay. All of their bios are in the program, with the exception of Representative Brown. So what's one thing you want people to know about you?
Well, I think I've worked with about half of you, so
right?
You probably know me quite well, but I represent Louisville, Lafayette, Superior. I was appointed in a vacancy committee back in January of this year, served this and have served as a legislator since. And healthcare affordability is really important to me. So I'm really pleased to be with you all, and thank you for allowing me to pinch hit on this panel.
Thank you for doing it. Okay, great. All right, well, let's start with a lightning round. So the first one is, what is the last great book you've read or podcast you've listened to? Or you could even tell us both. How about we start at the end with you, Representative Kennedy?
So let's see, let's first of all.
First, we'll get the mics to work.
There it is. Hidden button. So I wish I could say I read more often than I do, but I have a 2-year-old at home, and I find that any time that I'm not working is very focused on my family. A few years ago, I did, though, read a biography of Teddy Roosevelt, William Howard Taft, and kind of a discussion of the golden age of journalism called The Bully Pulpit by Doris Kearns Goodwin. There was a really insightful look at the way the politicians and the media can kind of interact either for good or for evil in some cases. So I think that's worth reading.
Thank you. Senator Fields, you.
Good afternoon. State Senator Rhonda Fields, representing Senate District 28, which is in Arapahoe County, and it also serves a portion of Adams County. I'm a member of a book club.
Nice.
And I've been a member of a book club for over, I would say, 15 years. And it's a small group of African-American women, and we study a book. Sometimes the book is one book per month, or sometimes it's a study book. And right now we're studying or reading the 1916 Project by, you probably know who she is, Hannah Jones is the author. And so it's a book about slavery, the first slave ship that came to America before Mayflower. And it just talks about slavery and the hardship and the oppression of slavery. And it makes me feel really privileged because I have privileges and opportunities that my ancestors didn't have. So I would encourage you to read 1916 Project.
Thank you.
All right, so I'm clearly not the most serious person up here. I'm sorry, it's hard to follow because what I was going to say was Dune, and and my podcast was going to be wait, don't tell me. So sorry for that.
That's
So
okay.
that's my answer.
Takes it all. And it sounds like we are able to have Representative Amabile on the screen. So and look at that. There she is. Can you hear us? Oh, we can't hear her quite yet. I'm looking at people who know. Okay, well, we'll do one more. Representative, we're trying to just fix the volume so we can hear you. Are you willing to disclose? Do any of you use artificial intelligence? Does anybody have ChatGPT? And I see lots of...
I do not, but in preparation, I did go online to learn more about it and try to enter some questions about where should I go for vacation.
Oh, what did it tell you?
It gave me a lot of different options,
Okay.
but I think I'll use it. I think it could be a time saver. And for me, and it's a new tool that's out there, I think I'm going to use it.
Okay. No.
I've never been an early adopter of new technology exactly, so I've steered clear of it on purpose, and after this morning's presentations, I'm going to keep that up.
Okay, all right. No.
No, I don't even know how to use ChatGPT, or I'm sure my children, who are much younger than I am, obviously, could probably do it. No, quite easily, but I'm not able to do that. So.
Okay. Let's see, Representative Amabile, can you hear us now? And more importantly, can we hear you?
Okay, I can
Yes.
totally.
Yeah, we hear you. Okay.
Okay, great.
Thanks
All
for
right,
joining
so
us.
Let me just say first, I haven't read a book in like 3 years. I'm a little bit embarrassed about that, but I'm not even sure I know how to read anymore, and unless it's a bill. And second, I don't know how to use AI either. I'm barely even able to use regular I.
Just telling it like it is. Thank you. All right. Well, before we get into I'm curious, do any of you have anything stand out to you from Joe and Kendra's presentation just a couple of minutes ago about kind of looking back at the 23 elections and looking ahead to the next session? Anything stand out that you wanted to comment on or respond to? And anyone in any order?
I mean, there was a lot that came up that fueled thoughts, and I'm hesitating because I could go off on property taxes or on the electoral stuff, which is not really the core focus of what this group is about. But I would say the continuing efforts to expand behavioral health and substance use disorder workforce in Colorado and build out a system where people have real access is a real challenge. And it's been something that we've been chipping away at over time.
Yeah.
But it feels like you never solve the problem. It feels like you've got your foot on the gas as much as you can, and yet you still hear these horrible stories all the time about people who can't get access to care, even if they've got good insurance, or even if they are enrolled with Medicaid and have a patient-centered medical home. And I think that there's so much work to do there that we're going to be talking about this for decades.
Okay. Yeah. Thank you.
And I would just like to add, I thought it was a very good introduction for the folks here in reference to the makeup of the House and the Senate and some of our accomplishments. And I would say the unfinished business I would have identified the same things, especially as it relates to behavioral health. I voted for that. We still are working to try to cobble that together. Mm-hmm. The concept is wonderful. The mission statement is so that anyone can have access to behavioral health no matter where you live across the state. And it should be like not a revolving door. You go in, you get referred to the services you need, and you're not caught up in this kind of cycle of not getting the treatment that you need. But we haven't gotten there yet.
Thanks. Representative Brown?
Yeah, I was going to add that I think that the focus on sort of health, what I'll call health-related social needs or social determinants of health, will continue. And I think that the land use conversation, the housing conversations that we're having are ultimately, at the end of the day, healthcare conversations. I thought the statistics this morning from the Chaz about, the health of people who are stably housed versus those who are not. This is something that my community is dealing with in the wake of the Marshall Fire. People have lost their homes and have been struggling to find affordable places where they can continue to live in our community. We are going to continue to grapple with these health-related social needs, whether they're nutrition or housing. And I think that was an important insight during the presentation.
Great. And I want to go back to that in just a sec, but I first want to see if we want to spotlight Representative Amable again to see if she has anything she wanted to respond to from the presentation just a minute ago.
Yeah, so I think for me, obviously, and the reason I'm here is we have to work on behavioral health. And to Senator Field's point, it can't be a revolving door, but it is right now. And every week at least, and today like 3 times, people reach out to me and say, hey, we're in trouble, our family's in trouble, who should I call? And I have nothing to give them. I don't have an answer for them. And that should not be the case. Every person should be able to get help when they need it. Just like if you were having a heart attack, you would know what to do. So I think that's a huge gap that has to be addressed.
Okay, thank you. Okay, we'll get back to that one too, but Representative Brown, you talked about the framing and these connections between housing, health, economic security. Curious, these were certainly topics from the special session that just happened. How widely talked about is this framing and this recognition of this connection, this intersectionality between these different topics and the relationship they have with each other? Was a part of the discussion during the special session. Do you think that that's starting to come online a bit more and recognizing it? And are we getting closer to making some of that interconnected change with some bills?
Yeah, thank you for the question, first of all. And I think I think we're moving in the right direction on those conversations. I know that just about as long as I've worked in healthcare, we've been talking about social determinants of health. But I think it's a game changer when we have the federal government now putting Medicaid money on the table for health-related social needs. It's changing the conversation not only here in Colorado, but nationally. I hope to continue to work on this and to continue to move us in that direction and hope to bring some of those federal resources to bear for things like housing. I do think that my colleagues, right, the ones sitting here, as well as others, know that, folks who are better fed and better housed are also healthier. And I think it's finally, when we invest in things like EITC or summer EBT or any of the number of programs that we've invested in, or rental assistance, like from the special session, these are the programs that are helping to not only keep people housed and fed, but help to make them healthier as well.
Thank you. Senator,
Yeah.
Representative.
I am extremely proud of the work that we did in the special session. Now, I have some battle wounds from it. It was hard for us to get everything done across the finish line, but the governor was really clear about what he wants us to accomplish in his executive order. And I'm pleased to say that we delivered for the people of Colorado. And the way we delivered that is that we ensured that the table refunds would go to folks. We ensured that we would maintain the summer nutrition program where we're feeding kids. We also ensured that there would be a tax-exempt child tax credit going to folks. We did the waiver, assistance for rental assistance, housing assistance, and there was 5 bills. I think I'll let you talk about the ones I missed. But we did everything we were asked to do in that executive order and probably more, but all of it was designed to make a life more affordable for the people of Colorado. And so I'm really pleased, even though it was painful, we still got the work done.
Yeah, the Monday, the 4th day of the special session was my 44th birthday, and it was the worst birthday I've ever had. Fortunately, I got a few days off after that for Thanksgiving break, and that made it a lot better. I actually do think that there's a broader recognition of health-related social needs. When I first learned about it when I came into the legislature, it didn't feel like it was being talked about a lot. And now I do think that you ask people about just in time for us to change the term from social determinants to health-related social needs, everyone's caught on and now they have to learn a new term. That said, I do think there is a broader recognition. I think people see it. That said, I don't think it was very explicit during the special session. And this happened for a variety of reasons. I mean, housing security, food security, general low-income economic security, those things stand alone and don't always have to be connected to health to be justified as a policy. And so I think that is really, the focus was mostly on the economic piece. But a lot of people had in the backs of their minds, this could impact people's health down the line. Unfortunately, everything we did in the special session, almost everything, was just for 1 year, right? This was kind of a put dollars in pockets next spring, see what we can do. I am also incredibly proud of how we apportion those dollars and really prioritize the people that are most likely to be struggling, because it is fair to say that too many of the dollars in Proposition HH went to the wealthiest and to the largest corporations who did not need those kinds of savings. And so in the special session, we focused those resources where they were most needed, and I believe it's going to be meaningful in terms of hundreds, if not thousands of dollars in families' pockets next spring. But the work will absolutely continue.
All right, thank you. And let's see if we can spotlight Representative Amable.
Okay, thanks. Yeah, I mean, I don't have a whole lot to add. I think we did a great job of a balancing of interests, of making sure that everybody got some relief and that the people who need the most got the most. But it's a 1 year thing. We did a 1 year fix, a Band-Aid, and there's so much more to do. And I know that everybody in this room understands that, and that's what we have to work on when we get back in January.
Thank you. Okay, just a couple more questions up here, then we'll open it up to all of you, so be thinking about your questions. Let's talk about behavioral health. Thank you for bringing it up, Representative Kennedy, and just at the beginning. It's top of mind for all of us as professionals, as people, as family members and partners and parents and neighbors. And we're not headed in the direction where we want to be going. And you all as legislators and everyone in this room as advocates and providers and policymakers in your own right in your communities have been working on it very hard as well too. What's left to do? What do we need to do differently?
Thanks. So much.
Yeah,
I think
right.
that, you look at the presentation that Joe and Kendra put on earlier, and they kind of rattled off these bits and pieces. And so a lot of the way that we work at the Capitol is, you work on one concrete item. So, okay, how is social media impacting youth? We'll have a bill on that. How do we deal with healthcare workforce this session? One of the things that is hard about being in a citizen legislature where we only meet 4 months a year and we don't have very much staff support and we don't get paid full time, so an awful lot of people go work other jobs the rest of the year, and then we have term limits on top of that, it is pretty hard for us to build comprehensive systems. So I would say that there's progress being made. There are initiatives that the governor's office has continued from the previous governor's administration where there is progress. And when I hear things about the social information exchange, I think that's critical infrastructure that will be key to what we do in the future. But I think that we do need to just keep on working on the fragmentation problem. We don't have a system. We have lots of different little access points, but this one you may not be able to pay for, or this one you may not be able to get an appointment for. And there's so many deep problems. And I would say an awful lot of it comes from the way that we pay for healthcare, where you've either got, okay, honestly, if you're on Medicaid, you're one of the lucky ones now because that is the closest thing to a comprehensive system. But even there are tremendous provider shortages because we don't pay the providers enough. And so I hope this isn't too doom and gloom, but This is kind of all of our life's work. We are all going to be working on this for the rest of our lives because it is that big of a challenge that we need to build solutions toward. I think I want to just add one more specific thing, because my real focus in this space has been on substance use disorders. I was the chair of the Opioid and Other Substance Use Disorders Interim Committee this summer. I've served on that committee in 3 other summers under the leadership of other legislators who came before me. And I think there is progress being made. We are working on getting rid of insurance barriers that make it harder, looking for new ways to create pathways to becoming licensed as an addiction counselor. And so there are things we can do there, but even these big, huge bills, they cost millions of dollars, are just one tiny piece of a much larger puzzle that we just have to keep working on.
Yeah, thank you for that response, because I feel the same way. We have all these ideas, but they seem to be independent, siloed, and patched. It's not coordinated, it's not in harmony, and it's causing a lot of confusion in the community. And the community I serve, for us, it's about access. I represent East Colfax. And so all up and down Colfax, when even I go to work, I mean, I can kind of see the people who are struggling with some type of behavioral health issue. Sometimes it could be a substance abuse, but it's a high number. I'm worried about our kids. I'm really worried about their behavioral health, especially since post-COVID. We had some young people here who were very articulate, but I didn't get a chance to really ask them, how are you? And when I'm saying that, it's really like, really, how are you? Because we see the social, and I brought my phone, I'll be sorry, but you see the social media interaction, and then I'm wondering how they're interacting personally. If you're so involved with 16 hours or whatever hours it is with social media, what are your social skills like? And how are you processing COVID coming back when you know someone in your family passed away? I mean, there's a lot, and then you're expected to just be normal after what you've just experienced. I don't have the answer either, but if I could have, my solution is all about access, and access means getting people the treatment where they are. And, you know, we need outreach. I need folks out there on Colfax. I need people on some of these corners. I need folks to have access to health care. You might have, you know, your food stamps or your card to get food, but what if you don't really have a kitchen and you can't buy hot food? I mean, there's a lot of other things that we can do to address hunger and housing and behavioral health, and all of those kinds of things come together, and it's all kind of tied to wages, because a lot of people are just like $400 or $600 from falling off the cliff. And then they find themselves in these circumstances that make it hard to get back. So we need to have a better and stronger safety net.
I appreciate all those comments. I think that the access issue, Senator, that you were talking about is really exacerbated by the way that we pay for health care, which is what Rep. DeGree Kennedy was talking about. In particular, in behavioral health, I think it's a problem because, you know, most of our, or a lot of our behavioral health providers do not take insurance in the way that your hospital does or your primary care doctor does, right? In some ways, it's much easier, and it is doable to be a behavioral health provider and to not take insurance, to take cash, or to be insurance friendly and give your client a statement of how much. We don't pay enough, I would argue, in the behavioral health space to make it worth a lot of providers' while. You know, it's much easier to treat the worried well than to work as a psychiatrist and trying to treat the most severely mentally ill. And that's a function of the way that we pay for health care, the prices that we pay for the types of services that we're talking about. And until we kind of get behavioral health fully integrated and we pay for it like we value it, we're going to continue to struggle to provide appropriate access.
Thank you. Representative Amable.
Yeah, thank you. So I guess what I would add is what I think we need to do is create a system, a continuum of care that prioritizes the people who are the sickest of the sick in both mental and behavioral health. And we are doing the opposite of that right now. We have a system that prioritizes the people who have the least serious illness, and we are ignoring or vastly underserving the people who have the most serious illness. And we don't do that with any other disease. If you're in a diabetic coma, you get rushed to the hospital and they take care of you. And then when they release you, they tell you what to do and they give you the medications you need and they follow you for the rest of your life. When you have a serious mental illness, you cannot get care. You are literally shut out of your community mental health center. You are barred from going to various facilities if you've ever had any violent behavior that follows you around and people won't see you because of it. And we need a public system that creates a continuum of care that serves the people who are the sickest. Because if we do that, if we create that, then everybody else will have a place where they can plug into that system. And it does cost a lot, but we're already spending the money. We are just spending it on jail, on prison, on homelessness, and on this lack of participation of a whole section of our people who aren't able to participate in the economy, who can't get jobs because they aren't getting the care they need. And I think that starts with building more beds, hospital beds, residential care, transitional step-down, group homes, sober living homes, supportive housing. And we need all of that. We need more of it than we have right now. And we need everybody to join in making sure that we work on that and that we prioritize that.
Thank you. And let's keep Representative Amable up, actually. There she is. I'm going to turn this last question into a lightning round so that we can get to our audience questions. Representative Amable, is there a health-related bill from the past few years that you feel hasn't gotten the attention it deserved?
Well, I don't know about attention. I think the one thing we did was we put some money into building some beds, and they're residential step-down transitional beds. And they're just starting to come online right now. And I had to fight like a wild tiger to get them to put this into the ARPA money funding because nobody wanted to do it because there would be ongoing costs associated with these beds. And they are just starting to come online. And now I'm hearing, in all of these conversations we're having about the competency backlog and the how many people are stacked up in jail and the wait list to get into the state hospital. We need more transitional beds. Okay. And so I wish I could have gotten more people to believe in that at the time when we had all that ARPA funding, but we have what we have. We need more of that though. And so, that's the one thing that pops in my head if I had to identify one thing.
Thank you. Representative Brown.
Thank you. Yeah, I'm going to say that there's a bunch of bills actually from as many as 13 years ago that has set us up and has given us we are a leader in many ways in healthcare in America. Colorado is leading the way on many of the most kind of innovative policies in terms of providing healthcare. And I think that a lot of that started more than a decade ago with a strong bill that created the APCD and future legislation that created additional transparency that helped to give us the tools and the understanding of what's going on or what was going on and what is going on in our healthcare system that then allow us to create important policies. So some of the work, I'm going to give Degree Kennedy a shout out here, because some of the work that he has done in creating additional transparency in terms of prices has really moved our affordability work in Colorado a long way, in addition to many of the other work that he's done on quality and value. The folks on this stage, obviously Rep. Amabile and her work in behavioral health, and Senator Fields on access to care, it goes without saying. But I just want to say that some of the work that the studies, the transparency bills that we have done over the last decade have set us up to be a leader, I would say, in America in terms of innovative government policy.
Thank you. Senator.
In the one bill I can think of, it was when I was elected in 2010, and my very first bill in 2011 was with Representative Tom Massey. Was it Massey or
Massey.
Massey. And it was a bill to address obesity in childhood. And so the thought in the bill, and it passed, and the governor did sign it, it was to require 30 minutes of physical activity in elementary school, and they're not doing it. So sometimes when we pass legislation, it's not fully implemented. And when I explore it, it's like we need to have a PE teacher to do that. Well, really, just stretch, go out and play. I mean, it's doable, and that was the requirement in the bill. But it wasn't really successfully implemented across the state to require every school child. That was my goal, to have 30 minutes of physical activity in the school day.
Yeah.
And we're still not there. They're still sitting stuck in their seats, and we still have a high rate of obesity in our kids.
So I've gotten really interested in primary care access over the last several years. And, one of the things that has been a talking point and a goal that has been talked about in all the big healthcare conversations is if you make these early investments in preventive care, you're able to head off the longer term costs of a variety of different types of more expensive care, including emergency care. And yet it seems like we're not actually making that much progress in that direction. There was a bill in 2019 that created the Primary Care Payment Reform Collaborative. I see Tara Smith back there. She runs it under the Division of Insurance. And this has been a group that has convened a variety of stakeholders who are invested in the future of primary care, and has given authority to the Division of Insurance to promulgate rules, including increasing the minimum spending on primary care. And so there's a regulation out there requiring a 1% increase in primary care spending. There may be some more details I'm forgetting there, but also tries to channel those dollars into advanced payment methodologies and other ways of increasing the value of primary care outcomes. Because I continue to believe that we need to reinforce that every patient deserves a medical home, a central hub, a doctor-patient relationship, and a way that the relationship with their doctor helps fuel their health and the connections they make to other providers. So I think that bill was very significant, and the work that is coming from that collaborative is ongoing.
Great, thank you. Okay, who's got, we've got, hands up all over the place. So I can't see that side of the room very well, so I'm gonna trust someone's gonna get a mic and ask a question, then we'll come to this side, then we'll come back to that side, so.
I think we're gonna start over here.
Okay.
If I could get help with the mic. Okay, there, I think it's on. We'll start with you.
Thanks so much. Good afternoon. Can you hear me okay? Wonderful. Since we are talking about that gap in coverage and that specifically we have a need for healthcare that is both integrative as well as synthesizing, I would just like to address what your guys' opinions are, or if it's even something that's been considered, looking at expanding coverage to naturopathic doctors. Currently, I understand that there's approximately 86, maybe 90 that are associated with the Colorado Association of Naturopathic Doctors, and there are more throughout the entire state that are associated with the American Association of Naturopathic Physicians. Currently, there is federal legislation that is being put on the docket to try and expand the Social Security term of physicians to expand to naturopathic doctors. But considering that there are efforts and boots on the ground being done here, I'm kind of curious if that's something that we've explored or if it's even crossed your mind.
Right. And maybe I'd ask if one of you wants to respond, just so we can get to more questions. So, and Representative Amabile, raise your hand if you want to be the one. Oh, yes. Okay. You get to answer this first question.
Okay, I mean, I had occasion recently to meet with a bunch of the naturopathic doctors in Boulder, and Rep. Brown was there too. And I feel like that is really a resource that we should lean into, and that it's absolutely important for us to allow naturopathic doctors to perform at the boundaries of their scope. They should be able to do all of the things that they're trained to do. And there is a very important role for them to play in our healthcare system, both in mental and behavioral health and in physical health and well-being.
Great, thank you. Okay, we'll take a question here. I think they're coming, and then we'll go maybe virtual and then back into the room.
My name is Ray, and I just had a question. You found me? I'm sorry, I was sitting down. So my question is, despite, just working on things that are just the symptoms of a lot of this mental health issues, housing issues, and things like that, like prisons and the effects of all these things going on in our city, in our state, in our country, really, what is our legislators doing to provide the community-based organizations with more resources and de-siloing a lot of these systems in order for us to be more effective in community engagement and providing, help from within our communities to our own community members?
Just one of you want to take?
Try that one. Very good.
Great question. And I think that we all do this when we look at bills that we are trying to pass forward. We always look for expanding access for all people. Or we're looking at how is that going to have a negative impact for certain demographics. But those are the kinds of things that we look at when we read and evaluate a bill. And personally, what I try to do is to make sure that we're increasing access that reaches all of Colorado, and making sure that we're not having a negative impact on some communities because of the way the bill is languaged. It's going to exclude someone. And so when I say access, I'm talking about rural, I'm talking about urban, I'm talking about suburban, I'm talking about economics, I'm talking about racial demographics. It could be based on income. But we try to be very diverse in making sure that we're not creating more harm, because government is really, really big, and it's very complicated, and there's a lot of red tape. So I know personally I look at ways to cut red tape and redundancy, and making sure that people can get access to resources quickly. Because a lot of folks just don't have that kind of time to kind of handle some of the barriers that we create. So I think as lawmakers, we're constantly looking for better ways to make it easier to get access to resources, even if it's grant funding. The state has done a marvelous job getting technical assistance for grant writing, making sure that we're just more accessible to people. Because if you don't, then things fall apart, people do desperate things, and it creates more government when we find that people can't have their resources, or they get health issues, challenges, but that's how I would answer. I think that we look for opportunities to expand access.
And I might just briefly add to that, a pretty healthy amount of the work that we've done over the last few years has been creating grant programs that fund community-based organizations. So particularly when we had the federal ARPA dollars, there were several different grant programs, largely for housing or behavioral health. Those were our two biggest focus areas that came out of that, but a lot of grants going to local governments, and as Senator Fields mentioned, the grant writing assistance programs that have tried to help the smaller organizations that maybe don't have capacity to apply for a lot of grants to take advantage. That's something that we're renewing in the substance use space. And lastly, I'll just add that local governments are starting to get opioid settlement dollars, and a lot of those dollars are also going to be going out to community-based organizations.
Great, thank you. Do we have any questions from the virtual audience? Oh, yeah. Looks like we're bringing the mic over so that we can ask on behalf.
Hello. Okay, we have a virtual participant, Sarah, who can't come off mute but wants to know if she could get tips from Senator Fields or anyone else on the panel about what advocates should do if a bill isn't being implemented fully.
Oh. So the question was, any tips or recommendations to advocates, to anyone really in the community who feels that a bill is not being implemented fully? You referenced the physical activity bill.
Let us know.
Okay.
You know, because we really like passing bills. I think I saw 820, I thought it was 630, whatever the number was. We like passing bills. And it's hard to kind of keep up with if it was implemented. The one that comes to mind right away is like, not right away, but the red flag law. You know, we had sheriffs decide, well, we don't like it. So we have some people and agencies that really don't like our bills, and they can slow things down, and we're into passing another bill. So I would say if you see something that's not working, and it happens a lot, this is where the voice of citizen and the voice of residents makes the difference. Because if it's not working, it's because someone's not implementing it. Maybe it's because they don't have the resources to get it done. There might be a good reason for it, but we don't realize it until someone tells us. Because I really trusted the organizations and our administration and the people who are a part of the government that we saw with all that money goes through. They're supposed to be implementing those ideas, but they get bogged down. Mm-hmm. And so you have to let someone know, and all of our information is public. It's on our website, Colorado General Assembly. Access your city council member, school board member, your elected officials, congressional. Let everyone that you know that needs to know what's working and what's not working, because I think that we're all in this line of work to do good work.
Thank you. Okay, maybe we can get to two more questions, maybe one from this side of the room and then one from the other side. I can't see who has the mic, so I'm just trusting.
That's all right, Sarah. I'm passing it over one more time. Here's our second question from this side of the room.
Thank you all so much for being here. Appreciate your leadership. My name is Maisha Fields. I'm a nurse practitioner, and I work for Salud Family Health Centers. I'd like to know, how are you guys grappling with the fact of low enrollment or disenrollment for Medicaid, and the crunch of community health centers and federally qualified health centers having to close shop post the ARPA funding? And what are your plans to make sure that we can retain nurses, doctors, behavioral health care providers, to make sure that we're not closing the safety net clinics across our state post-COVID and ARPA dollar funding?
So I'll go ahead and take that one. I really appreciate the question. I think what I saw in the CHAS data this morning is that clearly the Medicaid lock-in, for better words, for during the PHE was successful. It kept people in coverage. It has increased our coverage rates. And now what we are grappling with is going back to a point, business as usual or business pre-pandemic, and folks are losing their coverage. And that's not good for anybody, as far as I'm concerned. So we as legislators, I'm going to be taking lessons from the presentation this morning that Jeff gave, to think about how can we learn the lessons of the pandemic and continue them forward, because driving that coverage rate, or driving our coverage rates up and our uninsured rates down is a key part of making sure that community health centers can keep their doors open and that doctors can continue to practice.
Thank you.
Seems like an opportunity to talk about Tabor. When I'm not working on healthcare policy, I'm working on a lot of fiscal policy. And And I think that, the ARPA cliffs are a real challenge. I know that the folks over at Healthcare Policy and Finance are doing everything they can to plan ahead and build those longer term plans. But there comes a point in time where there are not enough state dollars. And just to paint a little bit of a picture of this for everyone, the state income tax right now is at the lowest point in the history of Colorado. It was a graduated income tax up until the late 80s. Then it was turned into a flat income tax at 5%. It's been lowered several times, including twice in the last few years by votes of the people of Colorado, and is now at 4.4%. That's the bulk of the general fund of the state. Even at that historically low income tax rate, we have collected $3.2 billion above the Tabor limit this year. These are dollars that we are required to refund to taxpayers. We're attempting to do that in the most equitable way possible by putting those dollars in the pockets of people who need help the most, rather than the highest income earners, which is the way it would have defaulted to. But think about what we could do with $3.2 billion. We could more than fully fund K-12 and higher ed in this state, which I just have to mention those because those are always on the conversation here. But think about what that would mean for Medicaid providers. Think about if we were not paying Medicaid providers 80% of the Medicaid reimbursement rate, and we're paying them at least parity with what Medicare, I think I said Medicaid twice, Medicare. If we were paying them the same as what the Medicare reimbursement was, or even more, because frankly, I'm looking at my friends with the Hospital Association here, I know that even the Medicare reimbursement is not adequate to cover the high cost of care in Colorado. Think about what we could be doing with those dollars to pay providers more, to make investments in healthcare infrastructure in Colorado, and to sustain these investments after the federal funding goes away. So I don't have a magic solution for that one yet, but believe me, I'm working on it.
Okay, thank you. Okay, can we get a quick question on this side? Whoever has, we've got a hand up right there. Take us home.
Thanks. I'm Catherine Moyer with the Hospital Association. Appreciate the comments. And actually, I think you, in some part, answered my question, which is why I was hesitating. But I really appreciate the focus on behavioral health for this panel today, and thank all of you individually for all of your work in that area. Certainly the consensus around the need for additional beds and additional providers and increased provider rates, I think, is a consensus concept that we can all wrap our minds around in this room at least. But we also know that ARPA funds are really holding up the BHA right now. And while I appreciate your work on Tabor and long-term funding solutions, the cliff is visible on the horizon. And so I was just hoping you could talk a little bit about kind of what some of the plans are. I was intrigued a couple weeks ago when I saw that Governor Newsom in California just announced a huge investment. It's actually a tax increase request in California of about $6 billion to create 11,000 new beds. Some parts of that are controversial, but is that the answer? Do we need increased revenue to make meaningful behavioral health reform a sustainable reality? Thank you.
And I might see if Representative Amable, do you want to respond to that question? We haven't gone back to you in a minute, so.
Yeah, I would. So do we need more money to make good behavioral health care a reality? Yes. What can we do here in Colorado about that? Well, we can't keep the Tabor money, and you're right, this cliff is happening. And so I have been interested in looking at potential ballot measures that would ask the voters, do you want to pay for mental and behavioral health services, and do you want to direct that money to people of all ages, from all over the state, from all walks of life, who have the most serious illness? And do you want to help with your tax dollars to create this continuum of care that we desperately need? And I think there's appetite out there for it, especially if we find the right thing to tax. And there was some polling that was done this interim about various ways of doing that. And I don't think we've hit on the solution just yet, but I am very much interested in asking people, because it is a public safety issue. It is a human interest issue. It is about making sure that we are doing right by the most people, and it's worth paying for. And again, it does save money in the long run, and I think we can really make that case, and we can make the case that we will have less people in our jails and prisons. Our prison budget just went up over $1 billion. And I was on a call yesterday. They're going to be asking for another 500 beds in our prison system. And those people that are in prison, 50% of them have a diagnosed mental illness. And we really could be doing this in a better way if we could get upstream and give people the care that they need.
Thank you.
I know that's not a whole answer to your question, but.
No. All right. Well, please join me in thanking our panelists. Thank you. And thank you for joining us virtually, Representative. Okay, you could stay or you could go down, whatever. We're just about done here. So I am all that stands between you and the reception. So I am going to try to be brief. Let's see. Okay. Well, they'll do a little few things. Okay, so now we're wrapping things up here. So if you still have a raffle ticket in your possession and you haven't put it into the raffle drawing, brilliant CHIers are walking through the aisles right now with buckets. So be sure to pass your raffle ticket down to the front so that we can have that. I'm really grateful for all of you who've been hanging out for the full day. I feel like we have covered a lot of territory. We start with understanding what's going on in trends in health and well-being in Colorado with the 2023 CHAZ. Then we kind of think a little bigger and a little differently with our discussions around AI. Then you all were in many different sessions earlier in the afternoon to really get into some more detail on things like the connection between climate and health and how your work impacts it, or how we can transform our systems, break down silos, and put people in the center so that we have people first transformed care using things like journey maps. And then in here we had a youth panel really talking about what they think about social media and what they would like to see happen in terms of social media and the relationship with their mental health. I wrote down one of these quotes. So there was a question about, like, would we ban social media or create some really rigid barriers around accessing it? And one of the youth said, "The youth will resist if that is what happens." I had to write it down. It was so funny. Okay, so last chance on that, on the raffle. Looks like we're good on that. While we are stirring things up, please help me continue. Well, we want to know what you think. Please, they're on the table in front of you are QR codes. Please be sure to fill out the evaluation. As a health policy research organization, we really care about data, and we really want to understand what you think about the conference, how we can improve it, what you want us to be bringing to this stage in these discussions, and how this can be of greater value to you in the work you're trying to do. So please do fill out the evaluation. Please also just thank you to our sponsors, Rocky Mountain Health Plans, a United Healthcare Company, the Colorado Health Foundation, Colorado Access. Oh, there we go. Our reception sponsors, who we will be thanking in person very soon, the Colorado Hospital Association, Trailhead Institute, and Partners for Children's Mental Health. Our scholarship sponsors, Craig Hospital, Colorado Community Health Alliance, and Intermountain Health, Caring for Colorado for our lactation room, Connect for Health Colorado for wireless. Did I get everybody? I think I did. And then we also gave a prize earlier today for registration through Green Spaces. One of the prize winners, her name was Lupita Garcia, and so she won the Green Space Prize. Before we get to the raffle drawing, which is the last thing we'll do, I just want to give a thank you first to all of you for being here, and really for your support of CHI over the last 18 months. We've been in a time of transition in the last year and a half, and we're just really grateful for all of you, our community, who has supported us as we have moved through that time and are coming into a new phase. So thank you, all of you, for that support. I also really want to thank the team who has made all of this happen. Thank you. Yep. Big round of applause. So our communications team is second to none. And they have been running behind the scenes all day, including coming up on the stage, handling things that we could never imagine. Biani Bermudez, Deanna Geldins, Joe Hannell, Brian Clark, Christy Ariano. We couldn't do Hot Issues without our amazing comms team, so thank you so much for your work. And then lastly, just want to thank the Hot Issues Project team, Mia Balifa, Nina Bastian, and Trenton Garber for their work. Like, they kind of keep all the trains going. So thank you to the three of you as well. Okay, now, the most fun is the drawing. Thank you, Emily. Oh, okay. Oh, well, so we do actually, I lied. We didn't give away the green space, the green spaces giveaway. So we're going to raffle two things off. You do have to be here. So for 12 months of what Green Spaces is calling their Jungle Club co-working membership, Green Spaces is a co-working space in Denver. So I do think it probably is best for someone in the metro area, but we're going to hope. Okay, so this is for the green space. Lucia Sanders from Civic. All right, come on up. Nice. Yeah, I don't have anything to give you besides a high five. Right on. All right, and then our last, we used to give away a bike. One of CHI's founding members and board members, Dr. Art Davidson, he's a primary care doctor at Denver Health, kind of the architect of health information exchange and public health informatics. He rides his bike everywhere. He's kind of my personal hero. We used to give away a bike. Then we decided in a few years ago, like, some people maybe just don't want a bike. They might want a gift card instead. So we are giving away a REI gift card to Lindsay Edwards. Are you here? Yeah, come on up. All right. No, you go for it, Kimberly. Okay. Congratulations. Okay. All right. Well, please do join us for the reception. It is literally just across the way, so you don't have far to go. Thank you. Thank you for making the 2023 Hot Issues in Health what it is. Appreciate all of you.